Hi friends, let's talk about some serious issue, that is protection of healthcare provider from tuberculosis. Tuberculosis is an infectious disease and usually healthcare provider gets the infection from patient. We all are regularly exposed to this infection. We have to protect ourselves. See, staffs like doctor, nursing staffs, and counselor, educator, cleaner, all sort of staff can be infected, and we are regularly exposed. And some of the healthcare provider, we don't take protection, we don't know about this protection, we don't know how to take how to wear mask or how to handle this type of patient, and we are regularly exposed, especially those healthcare provider who are living with AIDS or having HIV infection. They are particularly at risk, and the risk is more if the patient is already infected. Their infection will be flared up, and there will be some healthcare provider can get reinfection if they are exposed to the tuberculosis patient. And as you all know, HIV is a disease where the immunity of the person is suppressed. In those conditions, in those type of healthcare provider, this infection, this tuberculosis will be affecting the patient's health condition, and the AIDS will be worsened, and tuberculosis also, that is also a big problem to treat in this type of patient. So we should take care so that they cannot get the infection. I mean, they are not exposed to this type of infection. So these healthcare providers, they need regular training how to handle with different type of infection regarding infection control, that wearing mask and all, they have to be trained properly. Regarding mask, I have already made a video where I have described about mask, whatever mask can protect from tuberculosis. You can go through that video. And patient should be handled in a different manner by healthcare provider if the patient is having infectious disease. And if the healthcare provider is having cough for more than 2 weeks, the usual criteria of tuberculosis, then we can suspect tuberculosis, and we can ask for sputum smear microscopy to diagnose the case, and we can ask for a chest X-ray also. Yes, in this type of cases, we have to keep the information of the patient, I mean in this case the healthcare provider, secret. The treatment of the healthcare provider having tuberculosis will be same as other patient, and they will be receiving treatment from DOTS. This is free of cost medicine from government center. Not only AIDS, any other immunosuppressive conditions, if the healthcare provider is having any cancer or chronic kidney disease, chronic liver disease, diabetes mellitus, if the health worker is having this type of disease, then also healthcare workers should be very cautious and should use mask, should avoid going nearby multi-drug resistant tuberculosis patient. And the department, like inpatient department or outpatient department, the rooms should be in such a scientific way. These issues should be addressed by administration, but still the health workers should know these things and they should be trained properly. Friends, that's all for today. Thank you for watching this video and stay